Hey, I'm Dr. Khalil, internal medicine doctor, experienced with semaglutide for weight loss. We use a lot of compounded semaglutide and have had a lot of experience with well over 100 patients over the last 6 months. And I just wanted to share some tips and tricks with you that I've learned personally in my experience with taking care of people and aiding them with weight loss. A couple of things, you are able to lose anywhere from 30 to 50 pounds on this medication depending on your starting BMI. But here's some tips and tricks that I've found helpful along the way. Make sure that you get your medications from a licensed provider. I've seen some people that have gotten their medications from online, and I've heard stories about them not being efficacious, and I've even heard some stories about people getting little infections or sometimes bigger infections. You always want to go through a licensed provider so you know the source of your medication, and so that you're getting medical management and as well as some instructional teaching if you've never given yourself an injection at home. Whenever you're using compounded semaglutide for weight loss, you want to give it at least 6 months. A lot of people think that this is a quick weight loss like phentermine and it's going to work in 3 weeks. It absolutely won't. There are a lot of cases of people losing 5 to 10 pounds in 1 month, and that's great, but we have not experienced that with all of our patients. So make sure you give it the time that it takes. It does work through your metabolic system. It has a ton of health benefits. So even if you're not losing the weight, you are getting a lot of benefits with a lowering of your blood pressure, decrease in risk of cardiovascular disease, decreased fatty liver, and also a decrease in hemoglobin A1C. Be ready for minor side effects with semaglutide. That includes nausea, constipation, and sometimes even diarrhea. These side effects are usually minor. Another side effect that is kind of funny, but people have complained to me about, is that they're not eating. They're eating less. Well, that's exactly what the medication is supposed to do, and so just be prepared for minor side effects along the way. Whenever you're doing your injection, you're probably going to be using a insulin needle, somewhere like that, and it's good to grab some belly fat and inject kind of away from the center, away from your belly button. The closer you are to your belly button, the more you're going to feel some pain because there's more pain receptors there. So it's just a little tip or trick. Some people also use the bottom of the arm or the thigh. Whenever you are storing your semaglutide, a lot of times it'll come in a dark vial like this. I also like to keep it in a box or a dark black bag and keep it away from light. That way it'll stay preserved and fresh longer. You also want to make sure to use your medication within 30 days of opening. With any sort of weight loss, it always boils down to your activity level, your food intake, sleep and exercise. Also stress levels. So evaluate all those things whenever you're doing any sort of weight loss program. Be prepared to eat well. Be prepared to decrease the amount of carbohydrates. The easiest things to get rid of are sodas, sugary drinks, desserts, and fast food. Be aware that this medication can affect other things in your life. You may stop smoking. You may drink a lot less. If you use any drugs, you may stop using those as well. It does have activity against all kinds of appetites in my experience, so you may notice that. This is not a quick weight loss where you're going to lose weight in 3 weeks. It works a lot different than a stimulant type of weight loss medication like phentermine. The benefit of this type of medication is that it does not have the palpitations, the cardiovascular side effects, and the rise in blood pressure, and it can be used long-term very safely. There are several compounding pharmacies popping up and med spas offering these medications. I would aim for a larger doctor's office, a larger med spa that's doctor run, or a larger compounding pharmacy when sourcing this medication. Also be aware that compounded semaglutide won't last forever. The only reason we're able to prescribe this is because there is an FDA shortage, and that's expected to be going on in the near future, maybe for a couple of years. Reason being is there's such a worldwide demand for this medication. It's okay okay to take this medication with other weight loss meds like phentermine, but I would recommend stopping other weight loss medications when starting this one just to get a feel for it. And that's all I have for today. Thanks for taking the time.